Good morning, friends. Today I am going to talk about cone beam computed tomography software or CBCT software. This is a software of an Italian company which I am showing to you, which is the machine I am using. The basic principles for all the software are same, and for interpretation of maxillofacial area, the basics are the same. Now I will start the software. It's known as NNT software. With the help of single click, we start this software. We agree with the terms and conditions. We take the patient's data with the help of volumetric data. We have started the volumetric data. We have the records of all the patients which we have done on the cone beam computed tomography or which we have done earlier. Now I will start with a single patient. Now the scan opens the total views for that patient. It has basically three views: coronal, sagittal, and axial. These three views and a 3D view. This we can see on this computer screen. Now, coronal sections are the section which pass through the coronal line of the patient. Coronal means heart line of the patient. This plane. Then the sagittal sections take place according to the sagittal suture. And third is the axial plane, that is superior, inferior. Now these are the three planes. This is the axial section. In axial section, we see the maxillary sinus, the nasal cavity, then the maxillary arch. Now suppose this is the data which we have created. With the help of this rack of CD, we can explain each section of the maxillofacial area. This every section shows each area so that you can interpret that section on this axial section. Then comes the coronal, then the sagittal. This is the 3D view. Now this is the 3D view of an edentulous patient. The upper arch is edentulous, the lower arch is dentulous. And this is helpful for showing the patient or helping the patient to see its data in 3D structure. Now this was very basic. There are many other areas which we can interpret. Now these are the various views which we see on the cone beam computed tomography. Then comes the multi-planar reformatting. This is known as multi-planar reformatting. Now multi-planar reformatting means in any plane we can reformat the image. We can format in axial section, coronal section, sagittal sections, or slices in any other plane. This is very important. By adjusting the axis or the plane, we can adjust the sections very easily. Now we'll see the basic software details for this patient. Now with the help of multiplanar formatting, we have seen in multiple sections. Then comes this cross section. Now in this cross section area, we can interpret a particular area of the radiograph or the cone beam computed tomography, and we can select that area proper with cross sections of that area. And with the help of that cross section, we can see on the radiograph. This helps in the premolar areas to see the two canals. For detailing of that particular area, we can create cross section in any plane. Now coming to specifics, it's very helpful in premolar area, third molar area, and implant planning. Now this was the second part of the software. Then we go to the curved areas. New curve. In this we can create any curvature on the maxillary or the mandibular arch, and with the help of that we can create the cone beam computed tomography of that curved area. With the help of multiplanar, we can design the arch form which we need in the radiograph. By designing this arch form, we can select any type of arch form and we can interpret those areas. Then 3D view. With the help of this, in any plane, we can see the 3D structure of that patient with the help of this view. 3D with soft tissue, 3D with bone and soft tissue, only bone. Any type of 3D structure can be interpreted by this sectioning. Now, this was the basic about the software planning for cone beam computed tomography. For any queries, please comment, like and subscribe this channel. And if you have any doubts, please put it in the comment section. Thank you.